President Duterte is set to decide next week on the proposal to put the entire country under modified GCQ by March. Let's weigh in on that with Dr. Rontgene Solante. He is the head of San Lazaro Hospital's Infectious Disease Department. Good afternoon again, Doc. As usual, what's your position on this very possible shift to MGCQ status nationwide by next month?
Yeah, personally, if I'm going to give you my thought on this, I think it's still too early, or I should say, let's observe another month and let's look at the cases. Although I've been saying this that our cases have stabilized for the past months, but the specter of these new variants coming in and at the same time opening up some of this business establishment, increasing its capacity. We do not know yet what's the trend of the cases in the next few weeks, no? And if it will be opened up and the transition from GCQ to MGCQ, then we're really facing a higher risk here of possible surge of cases. But the point here is that since we want to balance also in terms of improving our economy, then we will just have to be ready and prepare that scenario and always advise the public to really be careful and follow the minimum health protocol or safety protocol.
All right, so that pretty much sounds like the opinion of a lot of other people that we have talked to. Do you think that this recently detected SARS-CoV-2 mutations or variants in Cebu should really be a big factor in the government's decision-making process?
I think so, because once we get to see the real situation there in Cebu, how many of those got the infection from these two index cases, and it's important here. The contact tracing is really important in order for us to get the accurate rate of transmission ongoing there in Cebu. So that means if it's happening in Cebu, there's also a possibility that there could also be other cases, not only in Cebu but also in other provinces like Davao or even Metro Manila.
All right. Speaking, of course, from where you stand, Dr. Solante, do you think our medical frontliners and facilities are ready for nationwide MGCQ or even for the NCR to go into MGCQ status?
I should say we are ready. Like in the government hospitals, for the past months we've been preparing. We prepared for the surge of cases after the holiday and after the translation, and we always keep ourselves and the facilities ready for any surge of cases that we would expect, but hopefully it will not happen.
Very comforting to hear, Doc. Now, of course, this decision, whenever it will come with a lot of guidelines. Do you, as a medical frontliner, of course, and as an infectious disease expert, have any suggestions as to what the government should prioritize in terms of guidelines?
The most important part here is really putting up the guidelines in the implementation of these health protocols, especially in the workplace, in the public transportation area, in terminals, okay, and in those establishments that we considered as high risk, like the cinemas, the gaming arcade, the theme parks, and including the churches. Now, because the plan now is really to open up and increase the capacity. Now, with increasing the capacity, you will also increase the risk of the transmission, and that's where we really want to implement at the ground level the emphasis on prevention, especially for the health protocol.
All right, yesterday we spoke to Dr. Guido David of Octa Research Group. He said that the one possible scenario that he does not want to happen is for cases to hit 2,400 a day again. If we hit 2,400 cases a day, are our facilities not going to be overwhelmed? Kaya pa rin ba at 2,400 cases a day?
Yeah, sa tingin ko, kaya pa rin dahil I think most of the hospitals now are allocating specific number of COVID beds for COVID patients now, and that's a good plan to really have that allocation of number of beds. Most government hospitals like San Lazaro and the other referral centers are already allocating like 20 to 30% of the capacity for the COVID patients, and I think also with the private hospitals, they are also mandated to do that.